Good morning, everyone. You all just missed what happened off camera. And my parents are up bright and early this morning and the music's playing and my mother just came dancing in the room. I'm gonna have to get it on camera one morning. The good news is our music is bright and uplifting and it puts you in a good mood to start the day. Okay, and this morning I've got my Pookie mug, and I got my little Puka down here. I went to listen to yesterday's video, and all I could hear was Charlie snoring, so I hope you all could hear the actual content, because, boy, there was loud snoring going on. And I did promise you today, so smiley every morning. Well, if you saw my mom come dancing in here, I'm going to be laughing all day. And it's going to be 74 degrees today. I'm wearing my Sunshines t-shirt from Nevis in the Caribbean. No way I can't be in a good mood when it's 74 degrees. Booger, our little mini, is actually walking much, much better. Again, this is one of those times when I say drugs to the rescue. I'm holistic. He's on herbs all the time. The herbs weren't cutting it. He's been on drugs, and boy, he's feeling much better. Got 4 inches of snow overnight. Boo! I don't know where you live, but I'm not going there. Okay. I told you that today we would talk about ways to control pain. So, you know, yesterday in our talk, we talked about the 3 things. Murphy says, thanks for taking out his rotten teeth. Oh, man, they were bad. 25 teeth we took out of that poor little Pomeranian yesterday. So we talked about the 3 reasons why, you know, euthanasia might have to occur, you know, and not being able to allow natural death. And those were uncontrollable seizures, respiratory distress, and uncontrollable pain. And the uncontrollable pain is kind of that gray area, you know, where we need to, you know, pull out all the stops, try everything we can to make our pets comfortable if they're struggling with pain problems. And I will tell you right off the bat that for the kitty cats, we don't have a lot of drugs that we can use. The kitty cats are much more sensitive. They don't have the enzymes to process a lot of the drugs. So for instance, we can get away with aspirin, which is a non-steroidal anti-inflammatory drug for dogs in low doses. I don't like to use it very much because it does cause GI ulceration. And 80% of dogs that are on aspirin on a daily basis will show stomach ulceration when we look at them endoscopically. So if we stick a scope down there, we see stomach ulcers. Your pet may not be showing you symptoms, and I get clients all the time who are giving over-the-counter aspirin to their pets. You know, they say that their pets aren't showing any symptoms, but their pets may be suffering with GI upset and pain that the clients aren't aware of. And, you know, it's kind of interesting. We're using the aspirin to treat pain, and then we're causing more pain. So, and I'm going to put in this note before we move on with ways to control pain. If you are giving your pets anything over the counter, whether it's a supplement or an aspirin or whatever, make sure you tell your veterinarian. There are a lot of things, whether they're herbs or supplements or aspirin, that do not play well together. And I have had clients kill their pets inadvertently because they're giving something, they don't tell the doctor what they're giving, the doctor prescribes something else, and the 2 in combination are deadly. On the flip side of that, if the doctor prescribes something and you're not giving it, tell the doctor. I had a client the other day with a Cavalier that's in heart failure. I had prescribed all the traditional heart medications for the dog. She wasn't giving them. And she was upset that her dog was in respiratory distress and not acting well. And it's because the dog was in heart failure because she wasn't giving the medication. She decided on her own to stop. But she didn't tell me that. So you need to know. I need to know if you're giving drugs, tell me. If you're not giving drugs, tell me. So we know that we're getting a combination of things that are not going to be a problem, even whether it's just herbal or supplements. Some of them don't play well together. Okay, so more about pain. So from a traditional standpoint, there's a laundry list of drugs that can be used to control pain. So in your cabinet at home, I don't recommend giving anything, but you do have aspirin, and that is semi-safe. It is not safe for kitty cats. Kitty cats cannot process aspirin. If you're going to give aspirin to a cat, the most common reason we would give it, and now there are much safer drugs, but the most common reason we've given it in the past is a baby aspirin twice a week for heart disease. But I don't use aspirin in kitty cats. There are much safer drugs now. So dogs do tolerate it better. Ibuprofen, not safe, causes kidney failure, GI ulceration. Oh boy, Aleve, naproxen, really not safe. Don't give that. You'll kill your pets with GI ulceration and kidney failure. So don't be looking in your medicine cabinet for things that you're going to give to your pets, because you're not going to find much there that's going to be safe, and you're going to do some serious damage. Every year I get pets that are killed by the owners giving things out of the bathroom cabinet, so please don't do that. So from the veterinary side, there are a lot of non-steroidal drugs that are used. Remedil was the first one that came on the market. It's still the most popular. You know, when you're the first to the market, you're always going to be the most popular. And generics of that, the actual drug is carprofen. So there are generics that are called that. We use one called Vetprofen. So there's a lot of generics of that on the market now, and it is used quite commonly. So side effects of Remedil, or really any of the non-steroidal anti-inflammatory drugs, we call them NSAIDs. Side effects: GI ulceration, vomiting, diarrhea, black tarry stools, anorexia. If your pet has any of those side effects, stop the drug immediately. Let's see, liver failure. It also causes liver disease. So if your pet has any GI signs, or is turning, the skin or the inside the ears is turning yellow, absolutely stop the drug. You're having a big reaction and problem. Certain breeds are more prone to trouble with the drug, Labradors in particular, Pit Bulls a little bit. So we're pretty careful with that drug. Other non-steroidals that are commonly used, Deramax is a biggie. I see that one. Medicam is a biggie. And these same drugs are used in other countries, sometimes under different names. What can be used instead of Novox? So Novox is another Remedil drug. So we're going to talk about a lot of different things. So that is a non-steroidal. If you switch, so if you're using one non-steroidal, so let's say you're using Remedil and it's not working very well, and your doctor wants to switch to something else, you need a minimum of 5 to 7 days from when you stop the first drug to when you give the second drug. So for instance, if you've been giving aspirin at home and your veterinarian prescribes Remedil, Deramax, one of the other Medicam, one of the other drugs, you can't give it for a minimum of 5 days. If you give it right on top of having given aspirin or having given another non-steroidal anti-inflammatory, the chances of GI ulceration and death are very high. So you need 5 to 7 days washout period. And that I see that a lot when pets are coming, and I get records from other practices. It's scary. And the other thing that absolutely cannot be used with non-steroidal anti-inflammatories is steroids, prednisone. So you cannot use a steroid and a non-steroidal at the same time. You will ulcerate the stomach, you will perforate the stomach or the small bowel, your pet will die. Do not use those together. I've even seen pets come from specialists on those two drugs together. I don't get it. I don't know, who's not doing their homework. So is Benadryl okay? Yeah, Benadryl doesn't do anything for pain, doesn't have a ton of side effects, but we do use it for allergies. So, okay, so we've got non-steroidal drugs, and then we have steroids. Steroids can be great for pain. Dexamethasone Prednisone, prednisolone. Kitty cats do better with prednisolone than prednisone. They don't process the prednisone as well. So I usually, yeah, super scary, I agree. I usually hold off on steroids for pain meds kind of until a last resort. You know, if the dog is 16 and he can't get up and we think he might be able to get up with steroids, then, you know, that's the time when I will say, okay, we can do that. Prednisone and gabapentin together, that combination works. Because gabapentin is not in the NSAID class. So, prednisone, I will use that not necessarily for pain as much as I will use that for nerve damage. So prednisone is great at taking down swelling in the nerve endings and then the spinal cord. So I use that more often, you know, if I've got a herniated disc or something. How much steroid is too much before the gut can be harmed? It is different for every animal. So somebody posted on a page the other day and tagged me in it. They have an 80-pound dog on 120 milligrams of prednisone a day. Oh my God. I would never give that to my dog. That's a death sentence looking for a place to happen. That is really high. I can't remember what the dog was put on for. Yeah, we'll talk about that, Teresa. So prednisone, if I'm going to use it, I mean, I might have an 80-pound dog that I only give 5 milligrams. You can use very, very low doses. The veterinary books call for much higher doses. I find that sometimes if you whisper the bottle of prednisone at them, you get a bigger effect and you get no side effects or minimal side effects. When pets are put on steroids at high doses, they're almost always put on some sort of antacid, cimetidine, famotidine, omeprazole, something to protect the stomach lining and decrease the chances of ulceration. With that said, I will tell you that using a non-steroidal drug like Rimadyl, Deramax, Metacam, and if your pet has GI upset, do not mask that with an antacid, because there is this little known side effect that can occur where the combination of an antacid and an NSAID will actually cause swelling of the stomach. It happened to my office manager's dog. We thought the dog was vomiting from eating a foreign body because he's a Labrador, but he had been on a combination of antacids and Rimadyl from another doctor, and he had an upset stomach with the Rimadyl, so they masked the symptoms with the antacid. And what happened, his stomach lining, his stomach wall swelled. It was this thick when we went in there. So there was no room inside his stomach. His stomach was completely closed shut with swelling. And Tramadol and famotidine. So you don't need the famotidine to protect the stomach for the Tramadol. Tramadol doesn't cause stomach upset. So if you're using them together for that reason, there's no reason to use them together. The famotidine is probably being used for something else, but not to mask something from the Tramadol. Side effects from Tramadol. So that's another drug that we can use. Tramadol is kind of in the morphine family, and Tramadol can cause constipation. It can also cause stupor or lethargy because it can be really sedative. And if you have a dog that you don't want them to move around, you know, that's not such a bad thing, but it can cause some constipation, so a little bit of pumpkin or something in the diet might be helpful for those guys. We are using Tramadol a lot. We use it a lot in combination with something like gabapentin. I will use it in combination with Robaxin, which is a muscle relaxer for dogs that have herniated discs and are very, you know, they have a lot of muscle spasm going on. So sometimes we'll use those in combination. So Tramadol is another drug that can be used. Biggest problem with Tramadol, it is now a Schedule II drug, so it has the potential for human abuse. We see it all the time, people coming in wanting bigger and more prescriptions for their dogs, and we have to cut them off because, believe it or not, we actually track how much your dog should be using, and we know when you're using too much and you're not going to get more, so don't try it with me. I know, I'm like the mean school teacher. Okay, So Tramadol, that's another one. Gabapentin we mentioned. Gabapentin is a really good drug, and gabapentin in the human world is Neurontin, and it is used for seizures. For our pets, it actually is a really good pain medication, and it works at the level of the nerve root. So it's working at the spinal level where the nerves actually come off of the spine. That's why gabapentin is used so commonly in the Cavaliers and the English Toys and the Brussels Griffons who have SM or CM, because that problem is in the spinal cord, and that drug works at the spinal cord level. So it's really good for pain in that area. Lyrica, which is pregabalin, is another step up from that. So let's see, feel guilty. I was told by my vet I could put my Boston Baby. Petcam, which is probably the same as Metacam. I can't see the rest of that. So yeah, that's Metacam, and it can have side effects. It's non-steroidal. So okay, so gabapentin, we like that one. I see very, very minimal side effects with gabapentin. Every dog in this house, except for my mother's, they're all on gabapentin for pain. Works really well. We, in our practice, insist on lab work every 3 months. Most vet practices, it's once a year. Some vet practices, it's never. But if your drug is on those chronic medications, I want to know what the liver's doing. I want to know what the kidney's doing. I want to know if there's any signs. There are things we can look for in the lab work that will tell us or give us an indication that there might be some ulceration going on in the bowel. So if the BUN is going up, that's the blood urea nitrogen. It can come from the kidneys, but it also can be coming from bleeding in the bowel. So if we have a high BUN, that might be an indication that there's something going on. Did we breed our Cavaliers? Nope, these are all puppy mill rescues. So liquid form of gabapentin has xylitol, had to have it compounded. Yeah, if we use liquid gabapentin, we're having it compounded. Okay, so we've covered a lot of drugs there. Another one that we'll use kind of at end stage because it's a little bit expensive is amantadine. Amantadine is a pretty good pain med. By the time I'm getting to that one, it's usually for dogs that have osteosarcoma, something where we have really intractable pain where other things are not working. A lot of these drugs can be used in combination. If we have pets who are really having a lot of pain, you know, we may be using multiple drugs, and we may be using drugs from different classes. My colleague's on Prozac. No, I don't see GI ulceration with Prozac. Okay. So there we are from the drug side. So let's look at some things that are on the non-drug, the more holistic side that we can use for these guys. I don't do a lot of work with homeopathy because I'm not a homeopath. I have not studied that. I'm a holistic, integrated veterinarian, so I pick from, you know, column A and column B. But I don't do a lot of homeopathy. So the one homeopathic product that I will use very commonly is something called arnica. Arnica is great for muscle pain and trauma. So we use, can gabapentin be used chronically? Yeah, we use it chronically. I mean, my guys have been on it for years. So arnica is something that I do keep in my first aid kit. I keep it around for us. It's a homeopathic. It comes in those little tiny pilules, so you're not supposed to touch those, so you're supposed to just put them under the tongue without touching them. So arnica is great. We use it for us. I'll tell you a story of how I discovered arnica. One day at work, a client came in, really good client. She's a lot of dachshunds. She does dachshund rescue. And I had a headache, and I don't get headaches very often, and I didn't realize that I must have been walking around with this kind of furrowed brow and squinted eyes. You know, it was pretty obvious that I had a headache, I guess, because she asked me. And I said, oh, I just had this headache. I can't shake it today. And of course, I hadn't taken any drugs because I don't like to do that. And she said, hang on 1 minute. She ran out to her car, comes back in, and she has this little cap in her hand, and it's got these 2 little white BBs in it. And she said, tilt your head back. So I'm a very trusting person. I did. She threw them in my mouth, and I said, okay, what was that? And she said, oh, that's arnica. It'll take care of your headache. And man, it took care of my headache. Within 20 minutes, I was like, oh, I feel really good. So, of course, that was my first introduction to it, and I've used it ever since. So I use it for the pets, and We use it for ourselves. It also comes in a cream. The Bach Flower Company, the ones that make Rescue Remedy, they actually make it in a cream, and it's really, really nice. So I use that a lot. I used it a lot on my daughter when she would fall off her horse and have trauma. Used it on Hugh because the horses seem to beat him up more than everybody else. I don't know why. So, okay, so arnica, that's the one homeopathic thing that I know about. Pretty sure that calendula is good for tendon and ligament strain, so we can use that as a topical salve as well. But that's about what I know about that. So from an herbal standpoint, we have lots of herbals. I tend to use, so what can you use holistically instead of pred? Licorice is the herbal form of prednisone, doesn't cause all the side effects. So we will use licorice very commonly. Yucca, boswellia, white willow bark. White willow bark actually is very similar to aspirin in its effects. Can cause a little bit of stomach upset just like aspirin can. So some of those things, we're going to be a little bit careful with. Let's see, that gives us lots of herbal things to pick from. There's a lot of combination herbs. I use herbs from Jing Tang Herbal, which is Dr. Shea's herbal company that goes along with the Chi Institute down in Florida. He's got a wonderful product called Body Sore, so we use that a lot for pets that have Lyme disease. They've had traumas, dogs that have been in a traffic accident, something like that, and they're just Singapore, welcome aboard. So pets that have kind of overall body soreness. So we have lots of different herbals that we can choose from. Other things that we use for pain, chiropractic treatments can be very helpful. I had a client in yesterday, her dog's an agility dog, and he likes to play frisbee, big dog. She's like 80 pounds. I don't know what she was. She had this long coat. She's really cute. But she was playing frisbee the other day, and when she went up, she let out a little bit of a yelp. Came down a little sore, not an ACL tear. I think it was more of a gluteal muscle on one side and an iliopsoas muscle on the other side. We did chiropractic on her yesterday, and immediately after the treatment, her range of motion and mobility was much better because we released a lot of muscles that had been really tight. So chiropractic, really, really good for, muscle and back and leg pain. Acupuncture is phenomenal for pain. Interesting story, Hugh went and had PRP, which is a platelet therapy that basically they take your blood and spin it and pull out the platelets and enhance them, and then they inject that back into sore spots. So he had it done in his back. And his doctor said, okay, you're going to be really, really sore. I can write you a prescription for Tylenol 3 if you want. And, he was a tough guy, and he said, no, I don't need that. I'll be fine. If I need anything, I'll take a little bit of Tylenol. Or I couldn't take a non-steroidal with it. So he said, I'll take a little bit of Tylenol if I need it. But he never took anything. He didn't need it. But he said, oh, I'm a little tender. But he never needed anything. And when he went back to the doctor for the follow-up, he said, so how did you do, and did you need to take pain meds? And Hugh said, no, I was fine. And the doctor said, it's interesting. The last practice that I worked in, when we did the PRP, people were always very, very painful. In this practice, we use acupuncture along with it at the same time, and the patients never have to have pain meds. So just the difference of adding acupuncture at the time of the painful procedure made it so that it wasn't so painful and the pain meds were not needed. So acupuncture is really, really painful. So we do it a ton for, back problems, joint problems. Mila, my grand dog, she's been getting acupuncture for her ACL tear and is doing very well. She's going to be here today. We're going to have her here for the weekend, so maybe we'll try to get her on camera. And so that brings up the next thing, cold laser therapy. Cold laser, absolutely phenomenal for any kind of pain, inflammation, infection. Absolutely love the cold laser, and it can be used in conjunction with the chiropractic, in conjunction with the acupuncture. Massage, another really, really good therapy for muscle soreness and pain. if you know anyone who does Reiki, craniosacral therapy, any of those energy healing therapies can be really good. And you can, those kinds of things, you can add those to the drug cocktail that you're using. Any of that can be really helpful. And because we always come around to food, the diet actually plays a huge, huge part in inflammatory conditions and painful conditions. So foods that have solanine, which is, white potatoes, tomatoes, eggplant, sweet potatoes to a much smaller degree, but foods with solanine, those are highly inflammatory. So if you have a senior pet who's got arthritis, don't feed them a food that's a white potato base. So, fish and white potato, that, for those allergy dogs, that's a very common food. So don't feed those foods if you've got pets with arthritis and pain, because it can increase the pain. So carbohydrates tend to cause more inflammation in the body because they break down to sugars. So when we look at foods like All Provide or the other raw diets on the market that don't have high carb loads, much, much better. So a lot of times we'll see inflammatory processes decrease just with the diet change. We find, for instance, the reason Tanya wanted to write the What's for Dinner Dexter book, when Dexter was being treated for his SM, he was on 3 to 4 pain meds a day. When she changed the diet, started home cooking, got the inflammatory things out of the diet, he went to 1 to 2 pain meds per week in addition to his routine protocol. So really, really, really important. Okay, so we used up a ton of time today, but it was an important topic. Hopefully lots of good information. It's going to be beautiful today, so I'm sorry, I'm going out, I'm taking some walks, but I'm also going to try to get some newsletters done to get out. Work for people also, you betcha, absolutely. Get those inflammatory things out of your diet. So I'm going to try to get some writing done today, get some newsletters out next week for you guys, and have a wonderful day. If you're in somewhere where the weather is like it is here, enjoy it. Okay, little happy music, see if my mom dances again. Talk to you soon.